think she said we had a video. I'll stop.
Speak behind you.
Sorry.
Thank you.
Okay. All set?
Are you guys all set? Good morning and welcome to South Coast Health. We're glad you could join us here this morning for our press conference, No on Question 1. My name is Keith Hovian. I'm the President and Chief Executive Officer of South Coast Health. I'll be making some brief opening remarks, followed by Cheryl Bartlett, the Chief Executive Officer of the Greater New Bedford Community Health Center, who will then be followed by Rick Kidder, President and CEO of the South Coast Chamber. One of our own nurses, Lee Pacheco, will also come up to the podium to make some comments. And then Mayor John Mitchell from the great city of New Bedford will close out our press conference today. That's not true. Mayor John Mitchell will make comments followed by Representative Chris Markey. My apologies, Chris.
Don't worry, I don't have to talk to you.
Good morning and welcome. Thank you for joining us here today. We have organized this press conference to highlight the fact that the issue of government-mandated nurse staffing ratios, which is on the community issue. Question 1 will impact our local economy, our local workforce, our taxes, our jobs, and public health in ways that we could currently only imagine. That's why we've invited some of our elected officials, business and thought leaders, and other healthcare providers to speak on this important subject. If question 1 passes, it will not only hurt South Coast, but it will hurt our ability to continue to provide the same level of services and healthcare within the region that we serve. Question 1 will cost South Coast alone an additional $38 million a year to hire an additional 255 nurses. There'll be increased costs associated with the nursing shortage that this will create. As demand for additional nurses will top over 3,000 in the Commonwealth, and that's on top of an average vacancy rate of 1,200 nurses per day. At any given time throughout the Commonwealth, costs will only increase. Recruitment will become more difficult, potentially having to look offshore in other countries to bring nurses to the Commonwealth of Massachusetts, where some of the very best nurses in the world work today. Layoffs and cutbacks, I can assure you, will take place both at South Coast and in community hospitals who will be most adversely affected throughout Massachusetts. For South Coast Health, unfortunately, everything will have to be on the table, including future investments in our community's healthcare. Now, this not just threatens the acute care hospitals, but it threatens some of the most vulnerable. It threatens patients with behavioral health challenges and substance use disorders. Now, as many of you know, we have answered the need for critical behavioral health services in southeastern Massachusetts, having with our partner opened South Coast Behavioral Health Inpatient Facility here in Dartmouth. 120 beds are in service today, and they're filled over 90% of the time. So if you've driven by that facility lately, you will have noticed that we've broken ground on putting an additional wing on that building to add beds that we might not be able to staff. South Coast Health is the region's largest employer and the only community-based not-for-profit system within the region. You rely, as a member of this region, on the high quality of care that our staff provides to you each and every day. And we rely on the flexibility to allow our nurses and physicians to determine how best to meet our patients' needs. And the data says that we do that really well, having been recognized year over year for the quality of services that our nurses, our advanced practice professionals, and our physicians provide each and every day. Let's not end that flexibility. Let's not increase waits for healthcare, waits for elective procedures, patient diversions to distant hospitals if we can't meet those ratios in our emergency departments. We don't want to see that. For 20 years, we've invested hundreds of millions of dollars to become a leader in community-based healthcare. We have brought to this region some of the latest medical technology. We want to be able to continue on that journey. Question 1 endangers that ability that we have to continue to invest. I urge everyone to vote no on question 1. Thank you very much for your consideration. I'll now introduce Cheryl Bartlett.
Good morning, and thank you, Keith, for including me in this important press conference. As Keith mentioned, I'm the CEO of the Greater New Bedford Community Health Center, and I'm also a registered nurse, and proud to say that I'm the first and only nurse to have served as the Commissioner of Public Health here in the Commonwealth, where most of our focus was on ensuring that we had access for our patients equally across the state of Massachusetts to get the care that they needed. And I'm voting no on 1 because I'm very concerned about this ballot question. I'm concerned, as the CEO of the Greater New Bedford Community Health Center, that this will create a shortage of nurses, particularly out in the community. As hospitals will have to recruit nurses, they'll have to pay salaries that are much higher than I could pay at the community health center, and it'll draw away the important nurses that are trying to keep our patients getting primary care and care out in the community. Behavioral health will be significantly impacted. I recently talked to the leaders in the behavioral health world, and they anticipate that we could lose thousands of beds. And I think we all know that we don't even have enough beds today to serve the behavioral health needs here in the Commonwealth, and particularly here in South Coast. I'm also worried about access. I, as the Commissioner of Public Health, saw 2 community hospitals close under my watch, North Adams Hospital and Quincy Hospital. And if there aren't enough nurses, or if the cost of care becomes too high, I think we'll lose services in hospitals, we'll lose numbers of beds, and we could lose whole community hospitals. And to me, this bill threatens access to important critical care for our patients when they can no longer be managed in a primary care setting. So I too am urging you all to really look at this bill. It sounds good. More nurses is a good thing, right? I mean, nurses are one of the most beloved professions in our country, and they do great work. But nurses need to make professional judgments about the care of their patients. And if someone walks through our doors and we have to say no to them, I as a nurse would be really saddened by that situation. So please think about this and vote no.
Good morning, everyone. I'm Rick Kidder, President and CEO of the South Coast Chamber, and I want to thank South Coast Health for the opportunity to be here. We've seen over the past few years an alarming proliferation of ballot initiatives put forth by special interest groups that have profound effects on our citizens and our businesses. The threshold for getting on the ballot is low. The issues are fringe issues. Bypassing our elected officials and going directly to the people often creates intended or unintended consequences, when a full vetting by our legislature and governor would have revealed the remarkable and expensive flaws in attempting to legislate through political campaigns, not the legislative process. Question 1 regarding the nurse staffing ratios is particularly disturbing to the business community. On the surface, the change in staffing ratios sounds like a good thing. Fewer patients per nurse sounds good. But the provisions of this initiative, in fact, could lead to catastrophic effects for our hospitals and ultimately for the patients. Hospitals are compensated in our modern system largely as the result of outcomes. They are already looking to staff their hospitals and medical centers to create efficient, quality care that leads to positive outcomes for patients without government mandates. Of the 50 states, only 1, California, has adopted mandated rigid nurse staffing ratios. And according to the 2018 Leapfrog patient safety data, the gold standard for assessing quality outcomes, California hospitals rank 25th for patient safety. Massachusetts ranks 4th in the nation without these ratios. This alone creates a compelling case for our medical professionals making good decisions at the bedside, not at the ballot box. I would not want a special interest group to mandate how I staff my business. I staff to succeed, and so do our hospitals. One look at the effect of this initiative on South Coast Health is illustrative of the challenge. South Coast Health, as Keith had mentioned, will have a budget impact of $38 million annually if the voters pass this measure. The net effect for all hospitals in Massachusetts could create a $1.3 billion problem. Where will this money come from? You and me and the businesses that struggle each day to provide quality insurance options for their staffs. Most of our community hospitals in Massachusetts barely hold on financially. The pressures on them to break even are immense, and it is likely in some parts of the Commonwealth people will lose their community hospital where most of the local care is delivered. Doctors, nurses, and hospitals across the Commonwealth have begun to speak out on the folly of this particular ballot proposition. And on November 6th, the voters will have the opportunity to either tie the hands of our medical professionals by voting yes, or allow our hospitals to make the right decisions for patients with the flexibility and care in staffing that's essential to their ability to provide quality care. So on behalf of the South Coast Chamber and the business community, we urge you to vote no on question 1.
Good morning. My name's Lee Pacheco, and I've been a nurse here at St. Luke's Hospital for 40 years. I'd like to tell you why I'm voting no on question 1. I have serious concerns about the negative impact question 1 will have on patient care. As a nurse at the bedside for many years and now a manager, I know the kind of flexibility that is needed to ensure each patient gets the best possible care based on their acuity and their level of illness. Question 1 will take that flexibility away. For instance, a nurse may be assigned 3 patients, having one critical that needs a great deal of care. Another nurse may be on the floor and has 4 patients, and one's ready to go home. If a patient gets admitted to the floor, as a nurse manager, I might assign that patient to the nurse who already has 4 patients, because the patients have less needs for care, and the nurse with the 3 patients. But then, if question 1 were approved, the flexibility of my decision would be taken away. And based on 4 decades of experience, that would be taken away, and we'd have to give that patient to the nurse that has 3 and 1 critical. Question 1 would also cause backups in the emergency department. That would have a domino effect and spill into the community. If a nurse in the ED has her quota of patients and one is ready to go home or one's ready to go to the floor, waiting transport, the nurse will not be able to take another patient until the patients physically leave the emergency department, even if they don't need any attention from the nurse. If a patient waiting for a nurse is brought in by ambulance and EMS staff is waiting until the nurse is free to take the report, they can't go back out into the field to other members of the community who might be seriously ill and need transport. Question 1 will also increase the cost of health care. That might force community hospitals like South Coast Health to cut important services. I have lived in this community my entire life. The patients I care for are friends, neighbors, family, people I've known my whole life. They need and deserve the best care possible. Question 1 would take that away, and that's why I'm voting no on question 1.
Good morning, everybody. So I really, I'd like to start off by thanking Keith for scheduling this event so close to my house. It's really gives the opportunity to get up in the morning and walk a couple of blocks. And no, I'm not like Bill Burns, who, despite living 2 blocks away, will still drive all the way over here. I start every morning the same way. I get up and I go out to my front porch to pick up my newspapers. And I'm a bit of a Luddite. I still get papers in the morning. I'm supposed to go online, and I get 3 papers that really agree on anything. I get the Standard Times, of course, I get the Boston Globe, and I get the Wall Street Journal for different perspectives, both geographically as well as politically. And I can't remember the last time those three newspapers editorialized about an issue in which they were lockstep with one another. Absolutely dead set agreed, each one of them recently, that question one is not a good thing for Massachusetts. And I encourage everybody, they're all three really good editorials, slightly different perspectives, but all come down unequivocally on the point that not only will question one diminish the quality of care in the state, but that will be hugely expensive, and will have a ripple effect in the economies outside of Greater Boston, namely us, namely Western Massachusetts, and perhaps in some other places. You know, I stand up here as a Democratic mayor, one who cares deeply about workers' rights and in every workplace, and I certainly count myself as someone who, you know, is supportive of what, I don't know, supportive of what nurses do, but I admire what nurses do on a daily basis, especially those who work in critical care hospitals, and who work with those who are of limited means and who are publicly insured, which describes a lot of folks in Greater New Bedford. But I can tell you that based on, you know, the homework that I've done, not just in reading those editorials, but also in discussing the matter with nurses, with you know, both Cheryl and Keith, the dire threats, the supposedly dire consequences that have been spelled out by the opponents of question one are not exaggerated. I mean, they are, to my mind, very legitimate. It is as Rick was getting at, it's in part a consequence of the ballot referendum process in the states that, you know, which often masquerades as a democratic, a way of enhancing democratic participation, but it has quite the opposite effect. When we ask people to decide complex policy issues on very limited information in the 1 or 2 minutes they're in the voting booth, the reality is that, as all the speakers have gotten into, the requirements will distort, especially care in emergency rooms, in ways that I think a lot of people can relate to. When, you know, for instance, there are times when over the course of any given week or season that there is not a whole lot of activity in the emergency room, the imposed staffing levels will add costs that are not offset by additional revenue, right? I mean, that just stands to reason. By people just sitting around. On the other hand, in those busy times, when staffing levels don't meet the requirements, then you will have the problem of people getting turned away. And I don't think that's exaggerated at all. That is not hyperbolic. That is to my mind, very real. And I don't want to see folks turned away from, St. Luke's having to turn away folks from the emergency room because they haven't checked the block on the staffing, the nurse staffing level. Nor do I want to see, especially folks who get mental health or substance abuse issues, to be told, you know, there's just no room for you here. We can't serve you. That's a problem that will fall on the city for sure. And then, you know, you have, you know, the nurses operated like part of any other labor market, right? And the new staff that a place like St. Luke's will be required to bring on will have to come from somewhere, and so it'll create this artificial scarcity of nurses. And where are they going to come from? They're going to come from places like the Greater New Bedford Community Health Center, right, which serves about 25,000 low-income folks from our city every single year. And so that's going to cause a problem for them, in addition to all the other problems that you'll face. So I think, you know, it's incumbent upon elected officials, and I really appreciate Chris Markey's being here today to take a hard look at this stuff, because you hear, you know, sort of the two sides going at it, and take an assessment of it and say, you know what, I've dug into it, and you know, I'm going to vote against question one, and for all of the reasons that I just mentioned. So I really appreciate, your speaking up, obviously, Keith and Cheryl, as well as the chamber, and I do think Rick is right about the referendum process. This is not the only time when, we've had to, as a state, to wrestle with things that should be left to the legislature, and the outcomes are oftentimes not what are intended when these ballot initiatives pass. And when they're not passed, we spend millions and millions of dollars on lobbyists and public relations folks that could have been spent more productively, honestly. So it's a long way of saying I think that question no will not be a net positive for New Bedford, and that's why I'm not supporting it. Thanks, everybody.
Thank you all for being here. I appreciate the opportunity to speak. I think I want to give you at least a little perspective of where I'm coming from, then talk a little bit about the legislative process, and then also the idea of what I've learned and why I'm standing here saying no on one. First, I'm a lawyer. I was trained as a lawyer. I tried a lot of cases, and there was one group of people, no matter if I was a prosecutor or a defense attorney, I would guarantee I would keep on the jury and fight to keep on the jury. And that's a nurse. They see the greatest things in life and the worst things in life. They have the most incredible experiences in their lives on a daily basis in their professional world. They save lives. They see the beauty of a new baby. They see the beauty of a family coming together at the end of someone's life. And they also see the difficulties of an opioid crisis in the emergency room. These people are truly the heroes of our Commonwealth and of our healthcare system. They deal with the most difficult people that there are. And they come in, whether they be with mental illness, with substance abuse, or with a traumatic car accident. There are high emotions, yet they are always stable, consistent. And the one thing you can say about the Commonwealth of Massachusetts is, because of them, we have the greatest healthcare system in the country. We protect people, we give them insurance, we have everything going in the Commonwealth. So why would we want to change that? Secondly, on regard to the legislative process, there has been a bill up there for years, each session regarding this. It hasn't passed. There's a reason why it hasn't passed. Because after deliberation, which we do in the legislature, and we think about everything that goes on, and we think about what we've heard as the unintended consequences, we've come to a decision that this is not a good idea. One is the cost. One is the hiring process. I just can't imagine if I owned a plumbing company and the state of the Commonwealth of Massachusetts told me I had to hire an extra 400 people. The quality of nursing would go down, just like the quality of plumbing would go down. Who wants to hire the bottom 20? Who wants to hire the bottom 100? We want the best nurses. And the way to do that is over the course of time, and maybe there's a legislative solution somewhere in the middle, but this isn't the answer, is hiring more nurses over the course of time, giving them incentives. There's other legislative alternatives that we can try to develop to get to the same goal that that the nurses who are voting yes say. But there's ways to do it, and this is not a way to do it, because a huge hiring crunch would just be disastrous to the quality of work that these nurses do day in and day out. Just think about it. Think of the job that you have, wherever it is, and think if they brought a mass hiring in, how many people you would have to train. The quality of those people, the educational background of those people, particularly in the bottom half. You're going to have nurses who are qualified, who are doing great work, spending more time teaching people and not caring for people. So that, in a nutshell, is the reason why I think no on question one is incredibly important to the people of the Commonwealth. So I hope you join all of us and vote no on question one.
That concludes the formal presentations that we had planned for today's press conference, but all of us and many in the room are available to anybody who has questions or might want to for more.
There's been other hospitals that have, executives that have came out, recently against the bill, including Cape Cod Hospital, to name another local one. Has South Coast Health been in contact with other hospital or health networks across the state?
Sure. Yes. So South Coast. The question is: has South Coast been in contact with other hospitals throughout the state as it relates to kind of coordinating efforts on no on one?
Correct.
And the answer is yes. So the Massachusetts Hospital Association, which is the major convener for all hospitals, has taken a unanimous position of no on one. But in addition to the Massachusetts Hospital Association, so has the Mass Medical Society, so has the American Nurses Association, the Emergency Nurses Association, the Association of Critical Care Nurses, the Association of Medical Surgical Nurses. So we've aligned with not just hospitals, but business leaders within the community. As you heard from Rick from the South Coast Chamber, the majority of chambers throughout the Commonwealth, the Associated Industries of Massachusetts, they've all kind of come to the table with us to say this is just a bad idea. Yes, please.
For both you, Keith, and for Lee, if I could, what could you do to alleviate some of the nursing burnout issues that perhaps have contributed to this push?
So the question is, so what could we do to alleviate some of the nursing burnout that's contributed to this push for the ballot initiative? The reality is, and I'm a nurse, so who spent a number of years in the bedside, and my experience clinically was in the emergency department and critical care, and it's a tough job. And it's many days you go home wishing you could do more. Many days you go home tired. Most days you go home thinking, "Wow, I made a difference." But to the point of nursing burnout, it's about listening to our nurses and understanding what their challenges are. Right? It could be as simple as this is an experience that we've had here. We changed our supply software. We felt we made an upgrade, but it got harder for nurses to get the things that they needed to take care of their patients at the bedside. And it's understanding what we could do to simplify and streamline their ability to take care of patients. Think about the electronic health records that we're all investing in, right? So South Coast over the last 4 years has spent $100 million putting in a new electronic health record because it improves patient care, it improves safety, it gives us data and analytics to help us take better care of patients. But it was a big learning curve for our clinicians, our nurses, our advanced practice professionals, our doctors. And we have to do a better job making things easier so that a nurse's time should be spent at the highest level of his or her license, right? So we don't want to have this ballot initiative happen and then have to lay off EKG technicians and phlebotomists and nurses' aides and then ask the nurse to do all those things in order to pay for this. We want our nurses to be able to use the skills, knowledge, expertise that they went to college for, that they've gotten associate's degrees, baccalaureate degrees, master's degrees, and doctoral degrees. We want them to really be at the highest level of their license, and we've got to be able to do that by enabling them to do that with the least amount of interruption, with the least number of obstacles in their workday, and it's all about listening.
I agree with Keith. It is about listening and listening to our nurses. And for several years now, the leadership team has actually done off-shift rounding every week to speak to the staff to say, what are your barriers? What are your barriers that are keeping you frustrated or away from the bedside? And we've been working diligently to remove those barriers so that, and the ones that the nurses identify. And right now, our CNO is working with another group of people because we heard a message what they want worked on. And it's the staff that are getting together with the CNO to come up with solutions, how we can improve communications, how we can improve the daily life of a nurse. So I think it all is communication and getting the answers from the staff.
And maybe I'd add just one thing to what Lee just said, which is, as we have made all these investments, in IT and other technologies, we need to leverage those in order to help us make the best decisions about patients. So patients have a range of illness, just like clinicians have a range of expertise and competence. We need to be able to match them really, really well. So our technology allows us to measure what we call acuity, right, which is the level of complexity, the level of illness that a patient may be presenting with. So how many treatments do they have? How many IVs do they have? What are their physiologic parameters look like? What is their blood pressure, their respiratory rate? We need to be able to take that information and use that so that our physicians and our nurses can make the best decisions about how many patients a nurse should care for. And that needs to be matched with, is this a novice nurse who's only a year out of training? Or is this a nurse like Lee who's got 40 years of experience and who could probably run circles around that novice? So we've got to get the matching right too, because that'll alleviate a lot of the stress.
Could you respond to the suggestion by the PRO campaign that, for the most part, the nurses who are voting no are nurse managers whose careers are tied to hospital administration as opposed to frontline nurses?
Sure. So the question relates to the assertion that most of the no votes from nurses are from nurses who are managers. And I would tell you, if you just go back a couple weeks and look at the WBUR poll, which looked at nurses from all walks of life, hospitals, long-term care, 50% of the nurses that they interviewed said, I'm voting no. 50% of the nurses that they interviewed said, I'm voting yes. So nurses are torn about this issue. It's not a slam dunk where a majority of nurses who are at the bedside are saying yes. This is an issue that actually even divides the profession. So I would respond that's just patently false.
President of the MNA, Donna Kelly Williams, argues that since it works in other states, it ought to work, in Massachusetts. Could you guys provide a quick response to that?
Sure. So my response to since it works in other states, it should work in Massachusetts. It's only in one state. It's only in California. And the last time I met with CEOs from California, they described for me what it was like to implement, those staffing ratios. It took 6 years because it was so complex. The hospital CEOs that I talked to talked about a really emotional process as they laid off every nurse's aide, phlebotomist, EKG tech, all the supportive personnel who work with nurses. And those nurses now are doing things that are really lowering their level of practice. They're not practicing at the top of their license, as I described. And a great analogy right now, I think, is the World Series analogy, right? So do we want to play like the Boston Red Sox, or do we want to have California impose LA Dodgers? Forget about it. We want to win.
I like
and we're winning in Massachusetts right now. You heard from it. The fourth best healthcare according to health grades, and I would argue that we're really, really, really good today. We shouldn't dilute that.
I think it's also worth noting that the question one would impose stricter requirements than California law would in terms of the penalties and the timelines and some of the other sort of baseline levels of staffing. So it actually goes further than a law that has been roundly criticized.
We are the healthiest state in the nation. And back to your question, I would say that if someone has a complaint about their work situation, the Department of Public Health and the Health Policy Commission have patient safety and quality committees where complaints can be lodged, and I think that they can come in and investigate. I don't know how widely that's known to people, but thousands and thousands of complaints are lodged every year at the Department of Health, and the Bureau of Healthcare Safety and Quality can look into those. So that might be a better avenue to go after the places where there are problems instead of sort of taking a cannon to shoot the problem that's much smaller than that weapon is needed.
Are you in a position now where you would like or need to hire more nurses and cannot afford it?
So the answer to that question is no. As we look at the vacancies that exist today at South Coast, and we have from time to time been challenged, but right now I think we have 95% of our RN vacancies or our RN positions filled. So we have about a 5% vacancy rate or less, so about 70 positions that are currently being recruited for. So we're actually in, especially as we now enter the winter months, we're in, I think, a really good position.
People for the voting yes on this question, they simply put, they say this is about greed. What's your response to that?
This is about professional nursing practice, and nurses and other caregivers, including advanced practice professionals and physicians, being able to make the best decisions for patients in real time without having government mandates that are really overly draconian.
Sounds like a wrap, Keith.
Thank you all for being here. Thank you. Thank you. Sorry, love it.
Hi, nice meeting you.